Hi, this is Kim Shrewsbury, and I've had a very busy week and have learned a lot and have had a pivot change in my startup business. And so I'm going to start out with my 2-minute pitch. You'll see that there's a little bit of a change to that. And so here I go. So, hi, my name is Kim Shrewsbury. I am the principal of Ardour Healthcare Financial Consulting. Ardour Healthcare Financial Consulting consists of several different services that we are able to provide. We have been discussing providing consumer-based reconciliation and summaries to ensure that that the consumer is paying the appropriate amount for bills that they have received from multiple providers due to a chronic illness or a long-term stay in the hospital or some type of post-acute care issue. So we have added 2 additional services to Ardour Healthcare Financial Consulting. And those 2 segments of business are more of a consulting nature to hospitals and physician office providers. And we will be engaging in working with C-suite type projects where there needs to be leadership, financial leadership in a healthcare facility or a physician's office that is currently vacant, and they're looking to fill that permanently. So they're looking for someone who's experienced and has a lot of years in healthcare that can come in and start the ground running. And so we are going to be offering that, and as well as offering revenue cycle assessments and action items that can be utilized to improve your revenue cycle. So that's where we have pivoted this week, and so that was my 2-minute pitch. And I'm very excited because a couple of these projects are really actually going to be happening over the next couple of weeks. It's been a very busy week. I've been in Birmingham all week at a healthcare conference, and so I've been able to get outside of the walls and talk to a lot of different people, both in the healthcare industry as well as outside of the industry. So I have been very encouraged in what I've been told. The consulting segments that I have added to my business and have discussed are areas of healthcare that I have worked in for a long time. I've actually performed the consulting piece and the revenue cycle engagements in the past, so I have been highly encouraged to add this to my company. So I've worked a lot on that. Have a lot of comments from others that I'll be talking about probably next week. I haven't had a chance to get them all together. And then also on my third piece of my business, the consumer piece that we originally started out with, I have learned about a company called RexPay out of California. I think I may have mentioned a company. I think I may have mentioned this company before, but I really wasn't sure what the name of it was or where or much about it. So I have been able to briefly look at their website. So I'm making contact with them, and I'm going to see if this is a service that can be utilized on the Panhandle of Florida and in the Southeast and in some of the areas that I'd like to work in. So I'll have more about RexPay in the next video for next week. So as far as my business model canvas, it has taken a pivot, and I have made those changes. I will attach the PowerPoint to my recording so that you can look at that. I have bolded the pivot changes. Just a few of the highlights of those changes is that my key partners have changed, and that now I'm going to have to work more with hospitals for my consulting side of the business, also physician offices, so that's going to make a change in my key partners and my key activities. Also, I've added to my value proposition. My value proposition is going to be creating a service in the healthcare market to assist hospitals with financial projects and interim staffing at the senior leadership level, and this is to include physician offices and revenue cycle projects as well. So this is going to be a lot more about networking and talking to those that I have known in the business for a long time, and let them know that I have started this new company and the services that I'm offering. So actually, it has been such a busy week that I actually have 2 engagements that are upcoming over the next 3 weeks. One is a revenue cycle assessment engagement that I'll be doing in Houston next week, and then I am also going to be working with in an interim CFO role for a healthcare facility in the state of Georgia. So that's coming up after Thanksgiving. So more to come on that. So I have a lot of work to do. I've actually created an LLC and a one-page website that you can see. I've made a copy of that on my PowerPoint. The cost structure is going to change a little bit. There's going to be some travel involved. There's going to be costs in actually developing the LLC and all of the permitting and all that needs to be done. Plus, professional business insurance is going to have to be liability insurance, and I'm going to have to obtain that as well. So I will be adding those dollars, and I hope to do a summary P&L to illustrate that in the coming weeks. The marketing channels for the consulting piece and the assessment engagements that I have added the networking with healthcare leaders, and then for my consumer piece, I have added senior services programs such as AARP, which was brought up by one of my colleagues in this class that I probably should consider, so I've added that as well. So my revenue stream has changed based on adding these 2 other options or 2 other divisions to my company. The consulting component, I estimated based on a 36-hour week and an average of 40 weeks out of the year working on these projects would create an annual gross revenue of about $237,600. So in the first year, that's probably a little bit strong. It may not be quite that much, but I felt like that was a good average to start. So the total potential gross revenue for the company at this point has increased, and it's at a total of $386,975. And so I'll try to show that in my P&L in the next week. So as far as our questions that we needed to answer this week, they felt right in line with what I was doing in Birmingham this week, and working with those in healthcare and also friends and consumers outside of the healthcare industry. So how do you create end user demand? That really hasn't changed for my consumer piece of my business. I've spoken about that in my previous videos. That's really going to be finding those consumers who have complex illnesses, long-term illnesses, long-term care stays that are going to have bills from multiple providers that I'm going to help ensure that their bills are correct and that they are being paid, that they are paying correctly, and working with their co-insurances and deductibles. For the other 2 segments of my business, though that piece will be mostly networking and talking with other hospitals to see what their needs are, and as well as physicians, and then also continue on building my website that I have started this week. How does it differ on the web versus other channels? Well, I just believe the web offers a much larger audience than a targeted type segment. So even though my website will be out there online, I think it will be a website that will be on my business card that people can go to and look at. I don't think it will be a website that will gain a lot of views from the general public. Evangelism versus existing needs. So my early evangelists for my consumer piece of my company are definitely a big part of my company, but the consulting piece and the interim engagements, that's already an existing need. So just as a note, I have done this before prior to being a full service CFO at a large hospital system. And so I feel like I've learned a great deal by with the experience that I've had over the past 5.5 years, so that my consulting business will be improved. Also, this will be the first time I've done it as my own company. In the past, I have done it through other companies as an employee. So, present and explain your marketing campaign. I think my marketing campaign is going to be simply networking and being able to sell myself as well as my services. That's probably a little bit tough for me. I don't consider myself a salesperson. I'm more of an accountant and a financial person, but I'm going to be working on that to improve that. Changing my value proposition and customer users or channels, I think I discussed that earlier in the video, and it'll also be attached to my PowerPoint that I have changed and pivoted this week. So I didn't think I was going to have a pivot during this class. I thought I was like going down a straight stretch and knew where I was going with this. But after talking with some colleagues that I have a lot of trust in, and I feel like they have a lot of trust in me, I felt like this was going to be a piece of my business that I needed to have that would lead me to more of the consumer piece, that the consumer division that I want to grow as well. So RexPay is the company out of California that I'm going to be investigating a little bit more over the next week. So hopefully I'll have more information for you then. So I really look forward to your comments. What do you think about my pivot? What do you think about the marketing? And so I look forward to that discussion this week. And gosh, it's been a busy week this week, and a lot of things going on. And the great thing is that this is turning into a real company. So I'm pretty excited about that piece of it. So thanks. Have a great evening, and I'll talk to you next week.